The pandemic revealed two things about Croydon. One was the sheer scale and depth of the inequalities that are faced here, and second was the absolute amazing community spirit that we also have.
I can be changed by what happens to me, but I refuse to be reduced by it. Maya Angelou.
I'm Rachel Flowers, I'm Director of Public Health for Croydon, and this is my Director of Public Health report around the magnificence of Croydon at the time of COVID.
The last 19 months have been hard work. I was scared, I think we all were. It was very difficult to shut down early. We were looking at people sitting, having coffee with us and thinking, no, they are infecting each other. This is not good.
Lots of deaf people didn't know what was going on with COVID. How are we expected to get more information? And where would we get it from? We are lost and missing information. It seems like hearing people can get this information already. How is that?
Just before COVID, I had open heart surgery. I was quite concerned about the follow-up, how the NHS was going to cope with me or how they're going to see to me.
Because I have a 94-year-old mother and I support her. So my first concern was, how do I get to her?
I would say the last 19 months has been the hardest, most challenging time of my life, probably. I was dealing with a residential home, which obviously had people in it that were most at risk and most vulnerable.
I would say it's been a time of awakening, a time where we've all, the whole world have actually realized that we don't really have it all together as we thought.
I was teaching, I'm a secondary school English teacher on London Road, and the rules changed overnight, so anyone who you were living with who had any symptoms suddenly meant that you had to self-isolate. So I'd come into school all ready to teach, and then my deputy head walked in and he said, you need to leave. Step away from me, step away from the children, pack up all your things, leave the building. It's like 9:30 in the morning. And I got on my bike outside and just kind of cycled home. I think it was only a few weeks later that lockdown happened. But the next day, I did a pregnancy test and realized I was pregnant and that I was going to have a baby in lockdown.
When there's a pandemic, you have to be brave in your decision making.
We'd already started pre-planning, thinking potentially we were going into a lockdown.
So we couldn't meet on a Sunday. Physically we couldn't, but Zoom, that technology helped.
I then got involved with the food bank hub at Croydon Voluntary Action. I delivered hampers at Christmas, but got involved with going there weekly to help sort the food donations from partners for food banks, local ones, to come in and then collect their food. It was a bit different, that one, because we were getting meat, fresh fruit and vegetables, which of course is not your usual typical food bank fare.
Every week there'd be someone asking, how can I volunteer during the COVID-19 outbreak?
And then I think it's just people, we step up, don't we?
Like a neighbour from within our congregation can go to another neighbour. Look, I've made a loaf of bread today, I'm a bread maker, I've made some baguettes. Would you like some? Our faith says we're reaching out to you and, we're going to get over this.
We've got 7 crates of food, as in the supermarket's crates, of food in church, because we've been running the food bank for 6 years. And we end up with 58 pallets of food being delivered to us by McDonald's. Trucks of food coming in when everybody had no food.
The hard bit is the finance, the financial bit. That's the only thing I would actually worry about. That's the only worry bit, but to stay in the house for me, I have no problem, so yeah. Yeah, I've got a little boy, he's 9, so yeah, it's good to actually have a staying with him, innit? So yeah, that's the best feeling. So yeah.
Even I, as like a resident who was here, didn't quite realise until we were delivering food into people's homes how difficult people's situations were, how difficult they were before the pandemic, that then exacerbated the problems.
My school is classed as being in a deprived area. We're north of the borough. There was a big increase in the number of students that now qualify for free school meals. We reached out to charities to get free laptops. There were some parents that were choosing to isolate their children due to medical conditions because they couldn't access the services that they needed at the hospital.
Teenagers sharing beds with their parents, no internet connection available. Sometimes there are rat infestations, damp is pretty common. And if you say to someone or a family, not only do you have to live in those conditions, but now you must be locked down in those conditions for months, and the only way you can access schooling is online, but your internet facilities aren't working or you don't have a computer, that obviously exacerbates all of those things that were already there.
I was at home with 3 children. They are all deaf, and my husband went to work. Hearing people have everything. Deafness does bring an extra barrier in terms of feeling trapped. My uncle from India had COVID and was rushed to hospital, but unfortunately it was too late for him and he died. Secondly, I had COVID too myself. I had to isolate by myself in one room, separately from my family for 2 weeks. I had to be patient and endure this.
I noticed our dry cleaners had shut down, and I only found out recently that's because the guy who ran it in his 50s died of COVID. And so there are just these lights that have just gone out. Yeah. I think every one of us knows someone who lost someone.
I was involved with the local GP hub rollout of the vaccine. It was really rewarding and great to see it so well run.
I was a little bit unsure about taking it to start with, and indeed we did have a Zoom conversation. A group from the ARCC had a Zoom conversation, and Rachel was very good to explain everything about the vaccine, and that quite reassured all of us. Yeah.
It was brilliant to have a vaccine.
It was elation, really.
Yeah, I think I started crying. We, as a global community, achieved something in, 6 to 9 months that we had never been able to do before.
My daughter was due to be born in November. The vaccine was announced, and I was just like, yes, she's coming into a better world.
I don't know how a defibrillator works, but if I have a heart attack, I want a defibrillator. I don't know how a vaccine works, but I want one because I know it's going to save my life.
As a Director of Public Health, I look at all the data around this, and some of it is not great, and some of it is okay. Croydon, like sadly London and England, had inequalities before COVID, and COVID has driven a great big wedge in the inequalities.
We were more vulnerable in Croydon to COVID because of those inequalities. We were more vulnerable when you have people living in overcrowded accommodation. We're more vulnerable if people can't go out to local green spaces because they don't have any. We're more vulnerable when people are deeply poor and don't have social connections near them. But it will also take action from businesses, from local government, from national government to deal with those really deep structural injustices and inequalities in our society that left us so vulnerable. And we need that extra support.
They should always prepare themselves for whatever comes, you know.
On one of the reopenings after the first lockdown, and a youngish man in his mid-20s came in with his young son to a cafe and sat down, and they started playing snakes and ladders together. And it was the first time we had seen anyone play actual board game for 4 months, and it was amazing.
Croydon, you are and were magnificent.
We got a lot of support, both sort of moral and financial, from both the council and the local bid.
With business and all that, it's hard. This 3 months grant is a bit of help, but it could be better.
But then we did have weekly meetings with Croydon Council by Zoom, and that was really helpful to keep us up to date on the government guidance and local guidance. Previously, the relationship between care home providers and managers with Croydon has been very much a relationship of inspection, monitoring. after this goes away, I hope Croydon doesn't fall back into that kind of monitoring inspection, which it does have to do, but you know, I hope that it keeps that support going.
People can cooperate and did cooperate and will cooperate when we know that it's really important to do it. I'm delighted that I do not have to be the one to try and lead us through this. Good luck to those who do it.
I could easily list off many people to thank: local government officers, the NHS, the police, the third sector, voluntary community, all of you. But I'd really like to thank those people who shared their story on this report, who gave a little microcosm around what happened in Croydon. In the future, people will look back at this film and see how magnificent Croydon was. The pandemic has taught us so much about what it means to be human and what we really appreciate. As individuals and as a society, there are small things we can do to help ourselves and others bounce back, including continuing to adhere to hands, face and space, and by practicing the 5 ways to well-being, by thinking of how we can connect, be active, take notice, learn and give.